Hey everyone, it's Nancy, the nurse practitioner here, and I'm hoping you're all doing well. Today we're going to talk about a really important subject, and it's about choking. How many of you have choked on something? And it's pretty scary. So imagine yourself out to lunch with your good friend, and you're having a good old time, and you're laughing, and you're drinking, and you're eating, and all of a sudden your friend gets up, grabs her throat, has this look of fright on her face, is wheezing and can't get air and can't cough and is just like, doesn't know what to do. Someone runs and calls 911 and there you are. What are you going to do about it? If you don't do anything and this object does not come out of the person's mouth, they'll lose oxygen to the brain, will eventually pass out and can actually die. So we're going to share some information with you and statistics and go over it together. Okay, so this is what we're going to learn today. We're going to learn that choking prevention and safety tips for children. We're going to go over some of that. Choking prevention for adults, how to perform the 5 and 5 to help someone who is choking, how to do the Heimlich on yourself if you were choking, and how LifeVac works, a really cool device that I found out there through a friend. So let's first go over some important statistics about children and choking. According to the State Department of Health, at least one child dies from choking every 5 days, which is terrible. Choking is the leading cause of death among children aged 1 to 3. And the most common foreign body objects are coins and balloons. More than 12,000 children are taken to the hospital each year for food choking injuries. And the risk of choking is more prevalent between the age of 0 and 3 and over 60. And so that includes people as they're getting older and elderly from a number of reasons, like different medical conditions, which we'll go over. So some choking prevention safety tips. Let's first go over foods that are deadly for children. Hot dogs, and we'll go over how to cut up a hot dog. Hard or sticky candy, which is round usually and just fits in that windpipe very easily if it goes down the wrong pipe. Popcorn, grapes, which are very slippery and should definitely be cut in half. Lollipops, when they just bite them off the stick. Dried fruit, because it just goes down, hard, and nuts and seeds. So think about that when you're taking care of a little child and keep these items away from them, these foods. Some choking hazards for children, some other objects that they may swallow and that are really a problem. You need to look around when you have a little one around is coins, buttons, toys with small pieces. That means toys that can come apart and then go back together, and toys that can fit entirely in a child's mouth, small balls or marbles, and balloons. So balloons are big because kids they're colorful. They like to put them near their mouths. And then if the balloon pops, they could suck in the actual balloon latex right down the throat, and it blocks the whole airway. Just terrible. So here's some other precautions for children. Children should not eat while they're walking, they're playing, or riding in the car. Vegetables should be cooked and cut into small pieces. Hot dogs should be cut lengthwise and then widthwise. And I'll show you that in the next picture. And then nut butters should be spread thinly onto crackers, not thick, where it just gets too gooey and gets stuck in the throat. And children should sit upright and eat age-appropriate foods. So here's an example of a hot dog on someone's plate, a little kid's plate. And I found this on the website, jtslawfoundation.org, after a little boy, 3 years old, very charismatic and funny, who died while choking on a hot dog. And so this organization was started to help people learn how to give age-appropriate foods and how to give them foods they like, the kids, but make sure that they're safe for them to eat. So as you can see, this hot dog was actually cut up into small pieces. Best thing to do is to take the hot dog, cut it long ways 4 times, and then cut into small wedges, very tiny ones, and then put it in the bun. It's still like eating a hot dog, but it's not a hot dog that's whole. Pretty cool, huh? So what do you do when your child is choking? The thing is, you need to use this particular method. With the child in the upright position, bend the child forward while holding the child with one hand at the waist. With the free hand, the other hand, which is this one with the arrow, okay, bend the child forward. With your free hand, give the child 5 back blows between the shoulder blades with the heel of your hand. So you're actually using this part of your hand and you're right on the back. If the object is not dislodged, put both hands together, making a fist at the child's abdomen. Place your fist right above the child's belly button, right here. You can see where the arrow is. And then use fast, short motions to thrust inward and upward, giving 5 quick abdominal thrusts. Don't lift the child off the floor while doing this, and continue 5 sets of back blows, followed by 5 abdominal thrusts until the object is dislodged. The child can cough and breathe, and the child becomes unconscious or help arrives. So you just keep doing it until you get the object out. Okay. Let's go over some statistics about adults and choking. For adults over the age of 75, choking is the 3rd leading cause of home injury or death. Choking deaths peak at age 85 and is the 2nd cause of unintentional injury or death in adults 89 and older. So, wow, choking gets even worse as we get older. Although not chewing food properly is the most common cause of choking, eating too fast, drinking alcohol, whoops, let me move me a little bit, and health conditions like Parkinson's, neurological conditions definitely can change your swallowing ability. And just so you all know, I do have a video on aspiration pneumonia. We'll be going over that in here as well about aspiration. So check out my other video on my Caregiver Success webpage, okay, on YouTube. Multiple sclerosis and ALS, which many of us know, is called amyotrophic lateral sclerosis, which is a progressive neurologic brain and spinal cord disease causing loss of muscle control, and Alzheimer's disease. These can all increase your chance of choking. Having dentures and difficulty with swallowing can increase the risk of choking. So even somebody with cerebral palsy and older adults who live alone are at further risk without someone there to call for help. So always think about when you're chewing or eating by yourself, that you be careful. But we're going to show you this device that you can use on yourself, which is very cool. One thing I want to go over real quick is that the American Heart Association does not teach the back blow technique. It only uses the abdominal thrust way, but the 5 and 5 is what we're going to be using today, which you just saw with the child. So what exactly is dysphagia? It is a difficulty swallowing caused by loss of the muscle function and coordination that can accompany these ailments, like cerebral palsy we just mentioned, or someone had a stroke, which can paralyze one side or one side of the face, or maybe even a weakness, and can change the neurological ability to swallow. A traumatic brain injury or a spinal cord injury, like we mentioned, Parkinson's, multiple sclerosis, muscular dystrophy, or ALS. So what can we do for prevention for adults? Well, use caution with foods like peanut butter, cookies, cakes, meats, large chunks of fruit. Make everything small, or make it pureed even. Person, chew the food slowly, especially if you're wearing dentures, and always refrain from laughing or talking while you're eating. How can we prevent aspiration pneumonia? Now, aspiration pneumonia means the food or liquid went down the windpipe into the lungs instead of going down the esophagus into the stomach. And if food starts to go down the wrong pipe, you definitely can get pneumonia. So how to prevent aspiration pneumonia? Provide a 30-minute rest period prior to feeding. Sit the person upright in a chair, if in a bed, elevating the bed 90 degrees. And you will see this on my other video where the person actually should be up and even forward, so that if you have to put a pillow behind their head, so their head is actually over here and their chest is forward, not lying down in bed like this. You definitely don't want to be feeding somebody in a bed lying down. Avoid pushing or force feeding, where you just keep pushing the spoon in the mouth and the person's not swallowing and they're just packing it in. Alternate liquid and solid foods, and depending on the type of defect, vary the placement of the food in the mouth. Determine the food viscosity that is best tolerated by the individual. So like I mentioned, there is something called Simply Thick. You can thicken your liquids so that soups are not dripping off a spoon, but glopping off the spoon. So here's some signs of choking that you will see: that the skin, the lips, and the nails start turning blue and dusky. You're clutching the throat, where this is the universal sign of choking. So even if you were in France and you didn't speak their language, that's what people do if they're choking. And they point to their throat. I just can't. They're suddenly cannot speak. They have these squeaky sounds when trying to breathe. They cough, which is maybe either be weak or forceful. So those are things you're looking for when somebody's choking. So here's the 5 and 5 I mentioned to you. If someone's choking, get behind the person, give them 5 blows between his shoulder blades. Now we saw what we do with children, but it's the same for adults. And then give 5 quick upward and inward abdominal thrusts by holding your hands between your lower rib cage, and just help them push the food out. Now, if you are by yourself, what you want to do is find a hard surface like a table or the top of a chair, and you want to take your fist and put it right into your belly, and then put your hand over it, and then bend yourself right over the chair so that you're actually using some force there. And this will help you actually, hopefully, with the force of the air against the stomach, push the food out. And here's an example of the food going down. As you can see here, the normal passage of food is a straight arrow. You chew it, it goes over the tongue, it goes down the esophagus, and it goes into the stomach. But if you're chewing the food and it starts going down the wrong pipe, here it goes down the windpipe, and there's the food, and it's sitting right there above the lung, and it's right in your throat here, pretty much like right here. And that's when it blocks the air, and that's when you start feeling like, oh my gosh, this impending doom. So we're going to talk about LifeVac. This is a really cool device. I'm going to turn off my screen for a minute and show you how it works. If you want to consider getting one of these objects, and I'm going to tell you more about it, you can go to lifevac.net to get one. And I'm going to show you this apparatus in a minute. If you want to look for food choking prevention tips that are available, you can go to www.jtslawfoundation.org, which is great for children, and how we can help prevent deaths that could be really preventable. So let's stop the share. Okay. And this is what the device looks like. This is called a LifeVac. You know, it kind of looks like a toilet plunger. It comes with actually, this is a mask that I use for a test mask. And what it does is it shows you how to put it on. There's a hole. So you can imagine this is where the food's going to come out of through the mask if you're choking. I love this device because you can use it on yourself. And you also can use it on somebody else if they're having trouble getting the food up. So at least you have another device available. So to describe what the LifeVac actually is, it's a non-powered, single-patient airway clearance device developed for resuscitating a victim with an airway obstruction, which, you know, in standard BLS protocol has been followed without success. So you want to try the 5 and 5 first. But I'll tell you what, having one of these in like every church where they serve coffee and donuts on Sundays, and most of the people are older, or in any place where there's food, maybe even school cafeterias, and whatnot, having it in a bag. It comes like this, in a nice little kit like this called LifeVac. All right, it has a child's mask and it has an adult mask. You have to be, I believe, 22 pounds to be able to use this. If you have any problems with, if there's no latex in it, so that's really good. So you take this mask, out, and you can see this, it goes this way, not this way, right? It has to have this area goes where the nose is, this cleft area here. So you are going to actually, it says adult M on it, put it in the hole and push it down on the surface just to make sure it's on there. And then what you do is you actually put it on the face of the person. It's called place, push, pull. Place, push, pull. And you really do get a suction. You can hold it on. Wow, I felt that in my throat, actually. Very, very cool. They also have one for children, small one like this. Okay, and again, the child should be over 22 pounds. So you could actually put this one on as well. Once you use this device once, you can return the whole thing and they replace it for free. It's like $69 to buy one of these. I just would tell you to go to lifevac.com if you want to order one. And again, like I said, even if it's used once, you can just have the whole thing replaced. And on my facebook.com caregiver success page, I will be putting the contact information and where you can return it. It comes with this whole kit, like how to use it, how to put it on the person, and that kind of thing. And again, you can get a travel version or you can get a smaller version. Just a couple more things I probably should tell you. It says that single use, of course. It says it can be used in children weighing over 22 pounds, as I mentioned. It's registered with the FDA. Anyone rescued by the LifeVac device should be evaluated by a medical professional after the use of it having had a choking incident. The general care for the LifeVac is keeping it in a safe, dry place, accessible in case of an emergency. You know, you don't want to have it in a closet on the top shelf. You want to actually tack it to the wall and maybe have a Heimlich maneuver sign next to it for choking so people know what to do when someone's choking. That should be wherever there's food, I think. Do not store this in direct sunlight. Avoid storing your LifeVac in environments where extreme heat or cold may affect the integrity of the unit. And an ideal location would be in a kitchen cabinet. Once you feel comfortable using it, dispose of the practice mask, repack your unit and literature back into the storage bag, and make sure that there's no mask left on this unit. It should not be attached to it. It should be separate from it. And there is a return policy in 10 days if you want to return it. So thank you for joining me on this video. I think it's really important information about choking. If you like this video, please subscribe to it. I'm Nancy the NP, and I'll see you in my next video. I'm on YouTube at Caregiver Success. Take care, everyone. Until the next video.